A question I often receive is, when should I do a facelift? And the easy answer to that is when you think you need a facelift. When you start seeing things sag, that's the time to do it. There's no magical age or number that happens like, hey, I see my face sagging, but I gotta wait till I'm 55 because that's what somebody said. I would say that gives you more years to enjoy what you're doing. One of the other misconceptions is, well, if I lift the face now, will my face be stretchier or will I age faster because I did a facelift? And it's quite the opposite. Actually, I think doing a facelift is like daylight savings time. Once you do a lift and you look 10 years younger, you always look 10 years younger. Of course, you're going to keep aging. The aging process starts right when I tie the last knot on the last stitch. You're going to start growing old from that time forward. But if you were to split yourself in half and person A gets a facelift and looks 10 years younger and person B doesn't get a facelift, 30 years from now, you're both going to age 30 years. But the person who got the facelift will have aged 30 years minus the 10 years they had with their facelift. The person that didn't get the facelift just looks 30 years older. So actually, I think the reality is a facelift actually lasts forever because it always gives you that 1 hour of daylight savings time, or in this case, the 10 plus years of daylight savings time. And so generally what I see from my observations, people start seeing facial aging right around the age of 40. And generally it's their mid-face. They start seeing a little line underneath their eye, the cheek flattens, the nasolabial fold starts, the corner of the mouth turns down, and they get some very early jowling that occurs. There's a lot of limited procedures we can do to help people that have this problem. And certainly there's a lot of non-surgical procedures, fillers, Botox, what some people coin the liquid facelift is a way to get a result without actually going under the knife. And in our practice, we have all the options available, depending on downtime, investment money, and what you want to get. Generally, when people reach their 50s, though, is when we generally start doing more traditional facelifts. In the 40s, we'll do some more of the mid-facial lifts, the mini lifts, the liquid lifts. This is also the time where we start doing brow lifts because, again, brows also drop a little earlier. In the 50s, we start doing a lot of eyes. And I shouldn't say 50s, maybe late 40s to 50s. And then as we get into the later 50s, we start doing the big full lifts, eyes plus facelift. A facelift done properly should last you 10 or 15 years, and people are living longer. And frequently in my practice, I'm seeing people who I did lifts on in the 90s that are coming back and getting lifts, maybe in 2010 or 2005 to 2010. They're actually coming back now for their third lift. And each of the lifts have lasted about 10 years. So, sometimes people just love the way they look and they don't want to give it up. Sometimes people do a lift and then they do some other things. They just, tweak it with Botox and fillers. And they're enjoying that 10-year bump they got 30 years later. And they don't necessarily want surgery again. This is we want to age gracefully and look our age, but we still look awesome from the surgery you did back in the 90s. So the answer to the question, when do you need a facelift? It's different for everybody. It's when you see things that are happening and when you decide that amongst all the options that are available, liquid lift, surgical lift, what meets your goals, how much you want to invest financially, and what you're comfortable with personally. So come in for a consultation and we can answer that question for you.